All right. Hi, Nay.
Hi.
All right. Thank you so much for joining me for this quick learning lesson about atrial fibrillation. So I'll go ahead and start the presentation. Give me one moment.
No problem.
All right. All right. So the name of this presentation is called Getting Control of AFib or Atrial Fibrillation. The learning objective for this uh, presentation today is the following. The learner will be able to understand the progressive nature of atrial fibrillation. The learner also, which is you, will be able to identify modifiable risk factors of atrial fibrillation. And by the end of this lesson, we hope that you'll be able to teach back some things that you've learned about atrial fibrillation. So,
Okay.
so we're actually going to start with a pop quiz. Would you be able to tell me what do you know about atrial fibrillation?
Isn't that something that has to do with my heart, like a
Yes.
regular heart?
Yes. And is there anything else you know about atrial fibrillation?
Uh, that is an emergent situation when I have it.
Okay. Anything else you'd like to share?
No, that should be it.
All right. So again, by the end of this lesson, we're hoping that your knowledge on atrial fibrillation will be a little bit more expanded. All right. So when you talk about atrial fibrillation, if you're monitoring it on a heart monitor, the normal rhythm of the heart, you would normally see, if you can just see where my pointer cursor is, the P wave. This is what you would see on the heart monitor, followed by a QRS complex, followed by a T wave. And the P wave, that is the depolarization of the atrium. Then you get the QRS um, complex, and that is the depolarization of the ventricles, which is the pumping chambers of the heart. And then you get the T wave, which is the depolarization of the ventricles, which is the resting phase of the heart where the heart is recuperating. That's how the heart normally pumps. It should be filling up in the atrium. The atrium then filters down into the ventricles. The ventricles then pump the blood up and throughout the body. And you normally see a normal rhythm. So this is what you would see on a heart monitor. You would see normal rhythm strip. In atrial fibrillation, however, the atrium of the heart, they're not they're not filling adequately and they're not emptying adequately. So you see that the ECG rhythm strip here is just chaotic. It's all over the place. So let's learn a little bit more about atrial fibrillation. What is atrial fibrillation? So AFib or atrial fibrillation is happens to be one of the most common cardiac arrhythmias, and this condition often goes undetected and therefore it's often untreated, which can lead to various adverse outcomes. It's noted here that uncontrolled or untreated AFib has an increased stroke risk for those who are not on proper anticoagulation therapy. And when you talk about anticoagulation therapy, you think of things like maybe heparin, or most people, when they are discharged from the hospital, they're on Eliquis, different medications that help to thin the blood out. It is also noted that atrial fibrillation is associated with a fivefold increased stroke risk, but anticoagulation is eligible. Ineligible patients can reduce this risk to about 65%. This is why it's important for people to follow up with their healthcare practitioner for routine screenings and lab work to determine their risk for developing or for controlling atrial fibrillation. So there are risk factors for atrial fibrillation, and those risk factors happen to include hypertension, diabetes, obesity, heart failure, and advancing age. And those are just to name a few. And I know that there are many people here in America who suffer with many of those conditions. So they are all, not saying that everybody would get atrial fibrillation, but they have a higher chance of developing it without controlling these modifiable risk factors. So there's a progressive pathway to atrial fibrillation. AFib can be broken down into three categories. First category is called paroxysmal AFib. And what is that? Paroxysmal AFib is a type of AFib which is short lasting or self terminating. So some people may have, go into AFib, and it's short lasting. Normally, that's less than 7 days. And it terminates on its own. So, like, in other words, the AFib, the heart condition, or the arrhythmia just happens to spontaneously resolve on its own, and the person goes back to their own normal sinus rhythm. Then there's persistent AFib. And with persistent AFib, this is a recurrent AFib, and it's often treated by antiarrhythmics. So you may have people who are on things like cardizem. They may be on things like beta blockers, things to help control the rhythmic or the rhythm of the heart. Um, these particular patients, if they don't happen to get their persistent AFib under control, then they can go into the third category, which is known as chronic AFib. With chronic AFib, this is a long-lasting atrial fibrillation. Treatment for this condition can include a culmination of therapies such as antiarrhythmics, anticoagulants, and various procedures such as cryoablation. So some patients, when they are not controlled by being on medications to help control their heart rate or being on blood thinners alone, if those treatments don't happen to control their AFib, then you may have a patient that go into the operating room or into the short procedure room for a thing called cryoablation, where they go in and they ablate certain areas of the heart to put the heart back into a normal rhythm. Also, other procedures like cardioversion, where they shock the heart, put the heart back into a normal rhythm. And then some people also happen to end up getting pacemakers. Again, something just to put the heart back into a normal rhythm. Next thing we want to talk about the risk factors of developing atrial fibrillation. So again, there are various risk factors for developing AFib. Simple changes in your health and diet can help to reduce your development of AFib. Implementing a heart-healthy diet and routine exercises can reduce risk factors such as obesity and hypertension. Also, eliminating things such as alcohol, cigarette smoking, all of those things help to lead to a healthier lifestyle, and they can aid in the reduction of cardiac arrhythmias and cardiac events. So let's talk about modifiable risk factors. There are many risk factors that can be controlled to help you keep you on a track for healthy living. It's noted that age, body mass index, height, hypertension, diabetes, obstructive, obstructive sleep apnea, myocardial infarction, heart failure, smoking, and genetic predispositions are well-established risk factors for AFib development and perpetuation. So here's just showing some things that normal Americans, find themselves doing. Some people, they don't live a healthier lifestyle, and they may just sit on the couch all day watching TV and not really getting much exercise. Some people happen to struggle with obstructive sleep apnea, and they sometimes forego treatment, which can include CPAP or, various type of surgeries to help keep their airways patent. Some people engage in cigarette smoking, which again is a risk factor for developing AFib, heart attacks, and then we see this patient here with pitting edema with the indentations on the legs. That's a sign of heart failure, which is also a risk factor for atrial fibrillation. And then we have this lady at the end holding up a glucometer as she's testing her blood sugar. So when we talk about risk factors, there are risk factors that are non-modifiable, and those non-modifiable risk factors are things that are happen to be noted here, like your age. That's one thing you can't change. You can't change your age. Everybody ages progressively. You can't change your height. Your height is going to be your height. So those are things that you can't change. You can't change your genetic predisposition. What you're born with, that's exactly what you're born with. So those are different things that you can't change. However, things such as hypertension, diabetes, obesity, all of those different things, those are the things that you can modify to decrease your risk of developing atrial fibrillation. So one of the things that they mention again is blood pressure. So atrial fibrillation, it can all begin with helping to control your blood pressure. So for many people who don't know what a normal blood pressure is, we want to see your systolic number, which is the the pumping phase of the heart. We want to see that no less than 120 systolic blood pressure. We don't want that higher than 120, and your diastolic, which when your heart is relaxing, we want that to be less than 80. That would keep you in the normal range. So people who, tend to start having elevated blood pressures, you may see things between like the 130s to 120s to 140s, and anything a little bit higher than 80s to 90s. That's when you're starting to get into elevated and stage 1 of hypertension. Anything above the normal range, again, puts you at a higher risk of developing atrial fibrillation. So the best thing to do is to modify your diet, exercise. All of those things will help to keep your blood pressure regulated and lessen your chances of developing that AFib condition. So now we're going to look here, and these are some tips for a healthy lifestyle. So, things that we try to encourage every patient or every person to do is to eat a balanced diet. That means including fruits, vegetables, whole grains in your diet, drink plenty of water and to stay hydrated. Adequate amount of sleep. People don't really understand how important sleep is. Sleep is when our body is able to recover and our body is able to um, actually reset itself. That's how we restore ourselves, is by getting some sleep. Eliminate any smoking, uh, exercise regularly, increasing physical activity, limiting or eliminating alcohol intake, and reducing screen time. Many, not just Americans, but people all over the world now are consumed by their electronic devices and find themselves often in a sedentary lifestyle because we're spending too much time on our screens. So reducing screen time and getting up and engaging in some physical activity is a great way to help get yourself on a healthier lifestyle, and also by keeping stress to a minimum. So now we're going to recap. Now that you've learned a little bit about atrial fibrillation, now it's your turn. So it's your turn to teach back. Can you tell me a little bit of what you may have learned about atrial fibrillation?
That it's an irregular heartbeat, that that if it starts due to what my diet is or my predisposition, that the doctor might have me on a certain medication depending on how bad it is.
Okay, excellent. Is there anything else that you can share?
That there's a lot of modifiable things I could do to live a better, healthy lifestyle so that I'm not disposed to it.
Yeah, okay, and can you share like maybe one or two of those modifiable things that are able to be controlled by us?
Through my diet, making sure I'm eating a balanced diet, if I'm smoking, to stop smoking, and getting enough sleep.
Excellent, excellent, excellent. So again, just a quick little education thing on atrial fibrillation, and I'm glad that you were able to take some things away from this. Again, there's modifiable and non-modifiable risk factors to atrial fibrillation, and we're hoping that by living an active and healthier lifestyle, that we'll be able to control our body weight, be able to control our blood pressure, and be able to control us going into this chronic condition called atrial fibrillation. Thank you so much for your time, Nay. And if you wanted to reference any of the things that you've learned, here's a list of references that you can look up in regards to atrial fibrillation. All right.
Thank you very much
Thank,
for the information.
thank you.
Have a good one.
You as well.